Good morning, everyone. Thank you for joining us for our Tobacco-Free Tuesday webinar on this beautiful Tuesday morning. My name is Ashley Smith. I'm the Program Manager for Tobacco Projects here at New Jersey Prevention Network and Tobacco-Free for Healthy New Jersey. We have a handful of fantastic presenters joining us today for our webinar with some insightful and knowledgeable information to share with everyone. This is our kickoff to No Menthol May. Can't believe this week it's already going to be May 1st. So thank you all for joining on for this timely webinar. Titled Flavor Fades, Addiction Stays, The Truth About Menthol and Flavored Tobacco Trends. So we're really excited to welcome our first speaker, Michael Kozlowski. He is a tobacco treatment specialist for the Mercer County, New Jersey Quit Center with the Institute of Prevention and Recovery of RWJ Barnabas Health. Also, just a reminder, we do have the Q&A feature and the chat feature. As Mike is presenting, feel free to drop any questions you have in the Q&A. If you have comments, you can put them in the chat. And as always, this will be recorded and shared on our Tobacco Free Tuesday webinar. So Mike, feel free to take it over.
Hi. Yes, I'm a treatment specialist. So my aim is really to help people directly quit using tobacco or nicotine in any form. So I'm here today because menthol tobacco or vape products cause some additional problems. Menthol is designed to keep people smoking. Everyone knows that. It's a flavor base that people really like. It cools the throat. It makes it easier to take in large puffs of smoke. There's some evidence, not very conclusive, that it is a product that makes people smoke more and may make it harder to quit. But there's a lot of different factors presenting that. If we could move on, Ashley. So menthol is really a compound that's added in. It's made from mint, which is good for us. But when it's added to tobacco, it adds this flavor profile that people really like. And it makes the smoke seem less harsh. And people become pretty attached to it. One of the piece of information I've been gathering is that people who smoke menthol are more reluctant to give up tobacco or vapes because of the menthol flavor. And the reason that comes up is because I often suggest to people through treatment practice is to change the brand of cigarettes, to shake things up, to really get things moving. Because at the core of quitting tobacco or vaping is making changes. So my anecdotal evidence is that people are much more reluctant to quit the brand they're smoking when they're using menthol. So, we do encourage it highly, that people quit and change from menthol. Oh, you could move on, Ashley. So we know that, menthol does cover the strength of cigarette smoke, makes it more pleasurable. And we really have to do a little bit extra to get people to want to change. And it could be harder with menthol. You could go on, Ashley. So we do know that people smoke more, and menthol does appeal to younger smokers because when you first taste tobacco or vaping, it's kind of harsh for many people who've never done it before. So menthol cools it and makes it much more tasty. So it's that flavor introduction that gets people hooked on tobacco and vaping. And menthol's sort of leading that pack to get people involved. With vaping, though, people do like the other flavors, but menthol's still pretty significant in getting people started on one of these addictions. Ashley, if we could move on. So it does make it more difficult to quit. We encourage people to not smoke anything or vape anything, but the best way, one of the steps to do it slowly, is to help people get away from menthol as a real focal point. And it's difficult because menthol in many communities of people of color, it becomes a cultural thing. Everyone in the community smokes menthol. So it makes it different. Why it makes it difficult? Why would people want to buck the trend of everyone they know? So there's a lot of different details that affect menthol and how it affects individuals. If we could move on. So yeah, we do want to switch. Um, there are certain techniques we use to help build up people's confidence and help them get away from it. And there are a lot of benefits to quitting tobacco in general. Menthol doesn't cause any additional health problems that we know of, other than prompting people to want to smoke more. But as we know, more smoke causes more problems. So one of the techniques we use is the 5Ds, and it's basically just a routine you develop on your own to help yourself when you're ready to reach for a cigarette. You want to delay. You don't reach for that cigarette. You try and distract yourself. You find something to do. You deep breathe. You drink water. You talk to someone about it. You just do everything you can to not reach for that cigarette. And because we are an evidence-based program, we highly recommend some type of a quit aid that you can insert into the middle of the Ds. So instead of picking up a cigarette, pop a piece of nicotine gum or lozenge and practice the 5Ds. So when you have cravings, you want to do different strategies to, again, take your mind off smoking. And you want to do flavorful stuff. Maybe have a snack, drink of water, something to fill your mouth with flavor to counter what menthol tobacco, the residues will leave in your mouth. Um, People can be angry, lonely, and tired, and they smoke for those reasons, stress. They feel that cigarettes pick them up. If they're tired, it gives them strength, which is not true, but it feels that way because of the brain stimulation. So we want people to do different things to help them not pick up a cigarette. Oh, so I'm basically done. I'm sorry, wasn't paying attention to my own slides. Um, so Ashley, should I leave it open for questions at this point, or do you want to do it later?
We can do questions at the end. Thank you so
Okay.
much, Mike.
If anyone has questions, I'm happy to answer them. And I strictly do treatment, direct treatment with people. I don't do the policy, but I can help. I'll answer any questions anyone has.
Thank you so much, Mike, for that insightful information. We really appreciate it and really setting the stage for the remainder of the webinar, really the harms and the dangers of menthol products and really how challenging it is to quit. So we're hoping that this No Menthol May is really a kickoff to help people quit, give them the resources and the information that they need. And everyone, Mike is available to help those that are in need of quitting menthol products. So please drop any questions you have in the Q&A. At the end, again, you can raise your hand and we'll offer a live opportunity to ask any questions for Mike and the rest of the attendees. But thank you so much, Mike. Now I will
Thank
turn
you.
it over to Pastor Ritney Castine, who will be speaking to the tobacco control. He's the tobacco control leader and community and faith leader. So Pastor Ritney, I will turn it over to you to introduce yourself and start your presentation.
Thanks, everybody, and good morning. Thank you so much for the invitation to be able to speak with you today. Again, my name is Ritney Castine, and I'm pastor of North Stelton Church in Piscataway, New Jersey. But I happen to have been involved in the tobacco control and public health field for quite some time, about 20 years or so, including stops at Truth Initiative and the Campaign for Tobacco for Kids, as well as a number of years in Louisiana at the Department of Health, where I got my start. And so this has been in part my life's work. Even as a pastor, it is a converging of what I believe is my calling and my duty. And so I really want to be able to talk with you today about some of the things that are going on in the tobacco control landscape at this point. Next slide, please. And I will try to, yep, there we go. So really, this is what we're going to take a look at as we walk through this particular presentation today. And the takeaway is simply that these are flavors that are obviously designed to appeal to kids. And so in spite of all of the progress that we have made in the tobacco control field over the last 50 years, there's still a great amount of work for us to do. Next slide. So there's a growing market here, and it's no coincidence. The tobacco industry really does know that flavored products appeal primarily to youth and new smokers. If you even see the statistic that is on the screen, it lets us know that 8 out of 10 kids who have used a tobacco product ultimately started with a flavored tobacco product. And so there you have, some different flavors that are there that really do appeal to young people. Next slide, please. On top of that, the data would show us that kids are not just experimenting with these products, but an increasing proportion of youth users are using them frequently or even daily. And that is ultimately an indicator of addiction. In 2024, 42.1% of high school e-cigarette users reported using e-cigarettes frequently, and that is 20 or more days per month. And then 29.7%, nearly 30%, reported using e-cigarettes daily. So from a 10-year period, 2014 to 2024, frequent use increased from 15% to 42%, and daily use increased from 9.7% to 29.7%. The takeaway is that we ultimately have a challenge and a problem on our hands. Next slide, please. And so today, high nicotine levels in e-cigarettes are very common. And what this slide shows is that trends in e-cigarette sales by nicotine strength from 2017 to 2022. The growing yellow bars reflect e-cigarettes with 5% nicotine content or greater. And for reference, Juul claims that their 5% nicotine content product is equivalent to the amount of nicotine in a pack of 20 cigarettes. Sales of products with 5% nicotine or higher increased from 5% to 81% between January 2017 and March 2022. Large format disposable e-cigarettes that allow for thousands of puffs, like Elf Bar, have also become widely available in recent years. And current disposables have been described as bigger and stronger and cheaper. And that's because the e-liquid capacity of disposable e-cigarettes has increased 5-fold, and nicotine strength has nearly tripled. Next slide, please. And so you see here, youth obviously prefer flavored e-cigarettes. 87.6% of youth e-cigarette users use flavored products. And again, 7 out of 10 current youth e-cigarette users say they use e-cigarettes. Why? Because they come in flavors that I like. Next slide, please. So this slide will show us that youth e-cigarette use continues to be driven by the widespread availability of flavored products. Again, in 2024, 87.6% of youth e-cigarette users reported using flavored e-cigarettes. And among youth users of flavored e-cigarettes, the most commonly used flavor types are fruit and candy flavors, followed by mint and menthol, as we heard a few moments ago. This slide shows sort of the most popular e-cigarette brands among high school users in 2024. And obviously, for those of you who are doing this work all across the state of New Jersey, you may see something different, even based on what is more prevalent in your own local communities. But by and large, these represent national trends. Next slide, please. And it gets a little scary. The next generation of e-cigarette delivers addictive levels of nicotine, but you also have animation and games and Bluetooth capabilities in a pocket-sized, affordable device. Yes, y'all, this is the smart vape, right? And so these types of devices usually have a nicotine concentration of about 5% and as much of 20 milliliters of the nicotine liquid. And so the Bluetooth connectivity enables the e-cigarette to act like a smartwatch, providing notifications for phone calls and text messages, social media activities, and other actions. And then on top of that, games that are incorporated into the device can keep people on it for longer periods of time. I said it at the top, but I'll say it again. It is getting scary, y'all. Next slide. So this is from the CDC, and you may be already familiar with this, but just to pull back as a reminder, e-cigarette aerosol, you can see some of the components, the flavorings, the ultrafine particles, including nicotine and cancer-causing agents, heavy metals, all of those things can be found in the aerosol. And so the takeaway is that it's not necessarily safe. I want to move to the next slide. And survey results also include a little data on youth nicotine pouches like Zen, and they have been increasing in sales. So while youth use of these products remain relatively low, these are products that I think we just need to keep our eyes on as we think about the next generation of youth tobacco users. Next slide, please. These things have been a problem for a long time, right? Sweet and cheap little cigars. They've only gone more off the walls with these different flavors. And ultimately, cigar manufacturers have flooded the market with flavored cigars. Literally hundreds of flavored cigars are available and make up about half of the cigar market with names like Berry Fusion, Ice Donut, Cherry Dynamite. New flavor varieties continue to be introduced even today. And what's really interesting is that these products are sold in shiny and very colorful packages and can be as cheap as 3 for 99 cents. And so flavored cigars have fueled the popularity of cigars among youth. 70% of high school cigar smokers have used flavored cigars, and Hispanic and Black youth have the highest rates of cigar smoking. Next slide. I don't want to be repetitive here. We talked about menthol a little bit earlier, but I do want to highlight that 88% of African American smokers use menthol cigarettes compared to 34% of our white counterparts. And generally speaking, half of youth who've ever smoked started with menthol cigarettes. And so menthol tends to be a gateway into other cigarettes. Next slide, please. And so the tobacco industry and the relationship with with African Americans continues to be complicated as it has been, and they really invest in making sure that new daily smokers are recruited through advertising, which includes sponsorships and music venues. And but what we are most used to seeing, particularly in neighborhoods of high concentration of African Americans and Hispanics, is the point of sale targeting. If you go in any corner store or bodega or whatever you want to call it in some of our African American and Hispanic neighborhoods, you will see that they're cheaper pricing. There's more in-store advertising, and there's obviously a featured power wall. Next slide. And this slide just shows you the decades of Target menthol advertising. You see all the way back from 1966 to 2015. Those images depict sort of some of the advertising and marketing efforts, particularly in African American media publications and others. Next slide. Within the African American community, there are obvious disparities. Menthol cigarettes increase addiction and they make it harder to quit, as we know. And Black smokers are less likely than white smokers to successfully quit smoking. And Black Americans suffer the greatest burden of tobacco-related mortality of any other racial or ethnic group in the United States. And you see some of those disparities on the slide there. Next slide. So, obviously there are some efforts that exist to take another look at prohibiting menthol cigarettes. And, this has been a start and a stop kind of effort since, 2009-ish. But, there are clear and obvious public health benefits to prohibiting menthol cigarettes. And so, we see some of those there, in particular to related to the African American community. Next slide, please. And this is not just the public health groups that are talking about eliminating or prohibiting menthol cigarettes. There's broad-based and diverse support to include some historic civil rights organizations and faith leaders and houses of worship and members of Congress. And so there's strong support, as indicated in some comments previously submitted to the FDA, as well as sign-on letters that have been circulating from the Campaign for Tobacco-Free Kids and others. This is not just an echo chamber, but it's a really good and sound public health policy. Next slide, please. And one of the things that I lead in my consulting work is trying to galvanize faith leaders, because I do know that faith leaders, whatever the particular tenets of belief are, right? But faith leaders writ large hold unique positions within their respective communities, have powerful voices and some legitimacy to add and to complement some of the workings and the messages that come from our traditional public health organizations and state agencies. And so I would encourage all of us to connect leaders of faith, again, across the spectrum, to be engaged, to use their voice to speak to these causes, because it is incredibly important. Next slide. So this tells us just a little bit about FDA e-cigarette enforcement, and I'll just share that since 2020, FDA has received applications for 27 million tobacco products. The vast majority of them are e-cigarettes. And so, as of September 2024, 500,000 are still pending review. And despite FDA action, e-cigarette sales continue to grow, fueled by illegal flavored e-cigarettes. Again, the tobacco industry knows that they can flood the market, they can overwhelm our regulatory framework, and kind of get away with things in this period of lagging. Next slide. This just simply shows the landscape with respect to the restrictions on flavored tobacco products sort of all across the country. And you see ultimately that nearly 400 localities have enacted some level of restriction on the sale of flavored tobacco products. That's as of February of this year, and those numbers continue to grow. Next slide, please. And so there's an importance of this. One of the reasons why I showed you the previous slide is because states and local governments are able to act much more quickly than the FDA to clear the market on flavored e-cigarettes. And we've seen states and locales take this into their own hands as a response to the slow pace of and the reality of the federal regulatory work. And so, lots of places that have tried this, for example, flavored e-cigarette sales have declined in about over 90% in Massachusetts and Rhode Island, over 80% in New York, 70% in California, since they did some state or local work there. So despite claims that e-cigarette flavor restrictions would lead to increases in smoking, the states that have done this work experience declines in cigarette sales as well. And then the final slide is that coming up really soon, in a matter of a few weeks, is No Menthol Sunday. This is spearheaded now for a bit more than 10 years by the Center for Black Health and Equity as a great way to engage houses of worship on the issue related to menthol cigarettes or even tobacco prevention at large. And so for more information, you can go to nomentholsunday.org. There are free materials and toolkits that you can have access to as a means to support and supercharge the work that exists wherever you are. I'll pause there. I think that's the end of the presentation as I would like to deliver it this morning. But again, I do want to thank you for the opportunity to share just a bit of information with you all today. And I'm happy to be around if there are any other questions. Thank you again.
Thank you so much, Pastor Ritney. We really appreciate you sharing all of that really valuable information with everyone. So if everyone has any questions or comments they'd like to share with Pastor Ritney, feel free again, please drop it in the chat, drop it in the Q&A. We will leave an opportunity for questions at the end. I know that was a lot of information between Mike and Pastor Ritney so far. So if you need a second to sit on it and then come with some questions later on, we understand. So now we have our other speaker, which is a wonderful national partner of ours at Counter Tools. I want to introduce Jacob Delbridge. He has more than a decade of experience in varied roles in public health policy, most notably in commercial tobacco policy and cannabis policy. He has worked in academia, state government, and in the nonprofit sector, developing expertise in stakeholder engagement, policy analysis, technical assistance, and program planning. So I will turn it over now to Jacob to speak about menthol and flavored tobacco in New Jersey.
Thank you so much, Ashley, and for that kind introduction. And first, just want to give a great thanks and gratitude out to Pastor Ritney. It really is such a privilege to have him here presenting based on his varied roles and experiences in public health and in faith leadership. And particularly now with No Menthol Sunday activities, it's just really such a treat. So thank you so much for coming and headlining this presentation. So as Ashley mentioned, I work for a nonprofit organization called Counter Tools. My name is Jacob Delbridge. We work to support localities, so municipalities, states, and federal partners, and across kind of a myriad of goals, from everything from doing store assessment work to policy analysis and technical assistance there to kind of many other spaces, both in terms of commercial tobacco work, cannabis, alcohol, gambling, really everything sort of at the point of sale and at the predominantly at the retail level. We call that our place-based public health engagement, where consumers have the greatest kind of exposure to both healthful products and damaging products. So today I'll be talking about menthol and flavored tobacco kind of vis-a-vis the federal landscape as well as New Jersey. So you can go to the next slide. So I just want to start with some stats because I think it's really important to understand the impact. So we know that 265,000 people began smoking each year due to menthol cigarettes over this period between 1980 and 2018. There was a great analysis that was done retrospectively to see this impact, and I'll be talking both about the impact at the population level as a whole across all groups, as well as the disparate impact for certain population groups. So you can go to the next slide. So we know based on calculating that through economic and health analyses that 3 million life years were lost due to menthol cigarettes between that same year range. And among Black Americans, menthol cigarettes were responsible for 1.5 million excess life years lost during that period, just for Black and African American population groups alone. The greatest proportion and burden of tobacco-related disease and death of any ethnic or racial group is felt by the Black communities in the U.S. And next slide. And we know that 10.1 million people became addicted to smoking because of menthol cigarettes. So they're able to understand the attributability piece of menthol and see that really striking figure between 1980 and 2018. And we'll have some additional data on what we've learned and what has evolved even since 2018 based on new product innovations and new studies and research that have been done. So you can go to the next slide. So again, I'll be talking a little bit more about sort of the menthol impact as a whole, but also really want to acknowledge the disparate burden that certain communities feel based on menthol, based on a lot of the sort of marketing, exposure, pricing policies, and other pieces that Pastor Ritney spoke about. You can go to the next slide. So we know the tobacco industry has used menthol to target many different demographic groups in order to spur on-ramps to use and addiction through targeted advertising and through manipulating menthol levels in specific cigarette brands that are marketed to teens, adolescents, Black and brown communities, LGBTQ communities, and more. The industry is very well aware of the evidence-based research that people who initiate smoking at younger ages become more addicted faster and experience much more difficulty in quitting, as well as what Mike spoke about around the physiological properties of menthol, making it much easier to smoke and inhale, smoother. So you're actually inhaling more nicotine and making it easier to start and harder to quit. And so they use menthol very strategically to attract new users, knowing that that is a really important interlude, sort of, you could say, between initiation and then potentially migration to non-mentholated products or maintenance on mentholated products. And we know that they do this in order to replace the more than what it says here, 1,200 people who die every day in the US due to smoking. That figure is actually now about 1,300 people who die every day in the US due to smoking. So about 480,000 lives annually. You can go to the next slide. So youth are the largest users of menthol compared to all other age groups. And so it's interesting, fortunately, as you might have seen, overall youth cigarette use has gone down, which is phenomenal. However, it's important to really look at the data and look between the lines. So the proportion of menthol tobacco use, though, relative to all smoking and tobacco use has either stayed stagnant or actually increased among youth and young adults as a proportion of all cigarette use. And over half of youth and young adults who smoke cigarettes smoke menthol cigarettes. So really the data backs up these approaches that the marketing, that the industry knows very well and that the public health community has known forever, and that the communities themselves have felt for decades and decades. And this figure is actually 90%, not just half of all youth, but 90% among Black identifying teens who smoke. Furthermore, youth use of mentholated products has surged, as Pastor Ritney talked about, in terms of the use of electronic nicotine delivery devices, or e-cigarettes. So the flavor profile of menthol has actually been sort of elevated in youth use, and that's for several reasons. But when we saw that fruit, candy, and mint flavors were prioritized for enforcement by regulators, by the FDA, to sort of crack down on the unauthorized products that were seen on the shelves, menthol was exempted. And we see menthol exemptions as sort of a common refrain, policy after policy. And what that did was lead a migration of youth users from mint to menthol, which is a very, very small jump for those who are somewhat familiar with mint and menthol properties, as well as, fruit and candy moving to menthol. And so we saw this huge surge of increase of menthol use among ENDS products, and we will see the impact of that over time. You can go to the next slide. And speaking about the particular populations where menthol is most impactful and damaging, we can see the prevalence of menthol is consistently and sometimes quite dramatically higher among these different demographic groups relative to their counterparts. So for example, white identifying people who smoke use menthol at a 30% rate. We see here that for Black identifying people who smoke, it's 88%, huge disparity. Straight identifying people who smoke use menthol at about 40%. We know that queer identifying people who smoke, it's 51%, sometimes more, depending on the stat that's referred to. And you can see, again, that sort of common disparate impact among different population groups. You can go to the next slide. And I wanted to talk a little bit about the market practices too. I think it's very interesting to understand how the data on prevalence, use, and trends is impacted by very strategic decisions in investments. So we can go to the next slide. So Truth Initiative did a really interesting national sample of US tobacco retailers, and it was actually found that price promotions for Newport menthol cigarettes, the sort of market leading spearheaded brand for menthol cigarettes, was nearly twice as common to have price promotions in neighborhoods with the highest proportion of Black residents. Also, the prices for Newports in neighborhoods with the greatest proportion of youth, Black residents, and lower income households were significantly cheaper. So it's a very strategic effort to make products accessible and really peddle them in communities that are more vulnerable or underserved through other services that aren't as prominent. You can go to the next slide. This one I found very interesting. So this is actually data from the FTC, the Federal Trade Commission, which puts out sales data reports on numerous different products, including cigarettes, now new oral nicotine products, e-cigarettes. They don't do it every year, but they have for the in different year increments in the past. This is from 2022. So you really can see here, and while it's not necessarily dramatic in 1 year increments, you can see that over a 20-year period, the market share for menthol cigarettes has consistently increased every year, a percent higher, percent higher, percent higher. And what this shows is the industry's investment in menthol products is paying off for them, and it continues to, which means why, it explains why they fight so hard to create carve-outs and exemptions for menthol among sales restrictions. If they see that product become more and more and more successful, that's going to be an impetus more and more for them to fight tooth and nail against flavor policies and restrictions. I'll talk about this a little bit later, that there are arguments among those against states and localities that have tried to, that have instituted sales restrictions on flavored products. The industry has consistently lost time and time again in court. So the precedent is strong for having states and the localities, oftentimes within them, depending on state law, have the authority to restrict the sale. And that is protections that have been put into place at the federal level to allow states to meet the minimum federal levels and go above in certain areas and be more protective. So it's important to recognize that while they do fight tooth and nail, they're losing consistently in court every time. Sometimes in the first court case that's heard or upon appeal. You can go to the next slide. And I think that's a good segue into some of the policy action that we've seen on menthol and flavored products. So you can go to the next slide. So as Pastor Ritney alluded to, due to legal action by the tobacco industry, menthol was, exempted from cigarette flavoring ban in 2009. So in 2009, all flavors except menthol were prohibited in cigarettes. A great achievement, and yet not a comprehensive one, as we all know. The Tobacco Products Scientific Advisory Committee, the sort of caveat to that was that they were required by the Tobacco Control Act to produce a report. They said, study the impact of menthol on the public health of communities as a whole, and in particular demographic groups, and provide that report to the FDA. Well, they did that, and the report, conclusively stated that, quote, removal of menthol cigarettes from the marketplace would benefit public health in the United States. And there's many more statements to that effect. In particular, the report describes the targeted marketing of menthol to youth and African Americans, Latinos, and other racial and ethnic minorities. And it describes the subsequent disproportionate use of these products and the resulting negative and disproportionate health impacts. So it's very conclusive in the language that they talk about, both in the TPSAC report as well as in a subsequent FDA report that was also issued with the same conclusion. And as Pastor Ritney talked about, public health leaders across faith communities, nonprofit organizations, and many coalitions advocated for years, more than a decade between when the Tobacco Control Act was passed and to where we are now and in recent years to demand action. They did this publicly. They did this in kind of at every level, between partner to partner at a public level. And finally, after not having action, after, at the federal level for numerous years when they were statutorily obligated to, suit was brought against the FDA to demand that action. And then in April 2022, the FDA did propose a rule to prohibit menthol in cigarettes. As you may know, this rule was delayed until 2024, and you can go to the next slide, was eventually put on hold indefinitely. You see here the statement by Javier Becerra in 2024, saying that basically the rule would not move forward under the Biden administration. And it seems quite evident that the rule will not be resurfaced during the current federal administration. However, as Pastor Ritney talked about in the examples of hundreds of jurisdictions that he had noted on his slides that have taken local action, it's really important to remember something, that most tobacco control interventions start at that local level and subsequently prompt statewide and federal action. So not having federal action on this is not wholeheartedly out of the norm of how we have seen tobacco control progress in our country. And I'll talk more about this on the next slide, but local governments and states often can and have instituted these public health measures that make sense for their community, that regulate the time, place, and manner of tobacco sales, including restricting the sale of addictive and harmful flavored tobacco products. And the TCA, the Tobacco Control Act, at the federal level expressly permits lower levels of government to go beyond that minimum statewide standard. that minimum federal standard, as I talked about in most areas. Really, the main area that states don't get into is, product standards, things that the FDA would do, such as the components of a product and how it needs to be sort of manufactured. But when it comes to place-based sale restrictions, it consistently falls within the state level authority. And so you can move to the next slide. A reminder for some, and maybe new for others, is that in 2016, we had what was called the deeming rule passed, which basically regulated cigars, pipe tobacco, gels, hookah, and ENDS products, most notably, so e-cigarettes, under the umbrella of the Center for Tobacco Products. So it just folded in these products. In addition to cigarettes, it also folded in these other products, saying they are now within FDA's authority for regulation, which is a big deal. And so in New Jersey, a couple years thereafter, the state, as you may know, prohibited the sale of flavored e-cigarettes, and that continues today. We know that, and this includes menthol flavor. We know that that is a law in the books today. The Attorney General in New Jersey has firmly stated that is a law that they are intent on enforcing, and have reminded retailers in violation that fines are, will be forthcoming and have been forthcoming, as well as other product seizures that have happened. And so we do know that they are on the shelves in many jurisdictions across New Jersey. So in that way, that what we see on the landscape is not always lining up with state law. However, fortunately, we know that between the different state offices that are really committed to enforcing that, and even call outs to the public and public health community to report noncompliance, there is a trend towards seeing that reconciliation between what's on the ground and what's in state law. And it's also important to know there's a very strong history of local level tobacco control in New Jersey. That isn't the case with every state for numerous different reasons, but New Jersey's really decentralized or local control across a lot of areas of health is in enacting more protective policies is a strong precedent, such as local licensing, distance requirements, and the regulation of sales. And for those who have attended some of the Tobacco Free Tuesday webinars in the past, we've had examples of our local boards of health and local health officers talk about those policies. And there's numerous examples. So if folks need connections to that, you have a wealth of resources and staff here who can point you to that direction and give you those examples of those local policies and how they've worked. And on that note, I'm actually going to turn the mic over to Elise from Tobacco Free for a Healthy New Jersey to talk about a policy example from North Bergen, New Jersey, that's sort of happening in real time.
Thank you so much, Jacob. And yes, we're really proud of the policy work that's already happened in New Jersey. But I'm going to highlight today North Bergen in Hudson County that in December of 2024 passed an ordinance aiming to protect minors from illegal tobacco sales. So North Bergen joins other municipalities, as Jacob mentioned. I'll mention some like Teaneck, Vineland, and Jersey City that have, among many others, that have strong local policy. So North Bergen's policy includes a $500 licensing fee, strong language about the license not being able to be transferred to anyone else except for the licensee, strong enforcement language, including a loss of the license. But for the first time, we have an ordinance that has gone beyond the state law, so beyond the ban of flavored electronic products. This ordinance bans the flavor of tobacco products. Yes, you heard me. That means menthol. That means the flavored cigarillos that, we've just heard about. All right. So this is a first in New Jersey. And I, reminded those at North Bergen, I was invited to do a presentation last Thursday night. And so the tobacco product retailers were invited to attend either in person or on Zoom, and it was recorded. And I reminded them that they are joining 395, counties, towns, states throughout the United States that have also done this. So they're not standing alone, but they are the first in New Jersey. And we had a strong frame of protecting youth and reducing youth initiation. So I shared with them some really strong findings from the Truth Initiative and the CDC Foundation's monitoring e-cigarette trends in the United States, their 2024 report. Not news to all of us, but 1.63 million youth reported currently using e-cigarettes. Young people show signs of nicotine addiction. Disposable e-cigarettes today have the equivalent nicotine levels of several cartons of cigarettes. Youth aren't just experimenting, but are frequently using. 29.7% reported daily use. And despite that daily use, 79% of 15 to 24-year-olds, and that was a stat earlier for high school students, the 29.7%, but the 79% of those using electronic flavored products, 15 to 24, reported wanting to quit. 8 out of 10 current youth e-cigarette users say they use them because they come in flavors that they like. And so one of the key findings of this report was state and local policies lead the way in reducing youth initiation. So just wanted to put a little exclamation point on that these policies do have an impact. And now back over to Jacob.
Perfect. Thanks so much, Elise. And yes, really helpful information that around these state and local policies. Something that was on one of my earlier slides. Actually, I didn't bring up verbally, but it's really encouraging to see even state level action being proposed in the legislature in New Jersey to address this huge gap of having flavored combustible products and other tobacco products continue to be sold. And seeing that both at the state level in terms of proposals and then now in local level in terms of those actions and the ordinances. So I did on that note want to talk about so we see California, Massachusetts statewide levels, and then local municipalities have been really kind of charging forward in taking those actions, and what we all get to benefit from is what is it they've learned along the way? What have been the takeaways that have been greatly have made their actions things that have been very positive, impactful, and have gone smoothly or well, and what are the challenges and obstacles that they face in putting forth these more innovative public health grounded policies that are stronger than the current status quo in at the federal level. And so what we've seen is that having a comprehensive policy that's well written, that has definitions that are broad, encompassing the many varieties of what can be considered, a flavor, how it's denoted, how it's marketed by the industry, really making sure that it's well grounded in kind of every possibility of trying to predict and look at all of the potential loopholes that the industry might use. Those are the policies that have fared the best. Really recognizing the difference, and we'll get into this a little bit, but in this slide, but the characterizing flavors versus the branded flavors. So what we see here is actually an image. It's pretty shocking, of a cool pack menthol cigarettes on the right, and they're non-menthol cool cigarettes that are sold in California and Massachusetts. So they look identical. They are intended to look identical because the idea is that they still sell to the consumer that is interested in a menthol product. And so they say non-menthol at the top. Oftentimes what we get into are these sort of concept, what these are called as sort of concept flavors. And what is a flavor, right? If it's a physiological impact on smoothing the respiratory system and your throat, kind of, you can think of a lozenge or a cough drop. Is that a flavor if it's having an impact that's cooling or numbing? And this is the sort of debate sometimes that gets into, it sounds like splitting hairs, but when it comes down to enforceability and the kind of loopholes that the industry tries to use to skirt the flavor policies that are in effect, it's very impactful. So using language, and I have to put in a plug for the Public Health Law Center, known as PHLC. You might have known them as the Tobacco Control Legal Consortium. They are based in Minnesota, and they provide technical assistance on this exact kind of thing. They have a team of attorneys that provide that technical assistance, and they have some really great, strong definition examples that certain jurisdictions have used to ensure that they're strong and comprehensive. So we can go to the next slide. Also, right at sort of the end of this last administration, we saw that the U.S. Surgeon General put out a really, really powerful report on the impact of smoking, but particularly the health disparities aspect of tobacco in the US. And so there's some really powerful statements. One quote I just put in here that I think really harkens to what it is we're talking about today, and the recognition based on, that this isn't just anecdotal or, an opinion of the Surgeon General, but this draws upon a wealth of research and data from health surveillance systems, case studies and meta-analyses, the National Survey on Drug Use and Health, NISDA. So it's really grounded in kind of this huge preponderance and overwhelming, unequivocal statement data around the impact of restricting menthol tobacco and what it would be for population groups. So having that in a Surgeon General's report is really strong, even if we don't see action during the current administration at a federal level. You can go to the next slide. So it's very important that we recognize the intent of banning the sale rather than use. So this represents a really important focus on a population level approach upstream that avoids stigmatizing and targeting users of menthol products. So not only would a law banning menthol use be difficult to enforce and may spur disparate and targeted policies and enforcement, fueling distrust between residents and law enforcement, it also greatly misses that opportunity to address that upstream intervention, which is the tobacco industry's pervasive and abusive reach into the community through its product sales and advertising. So it's really important to recognize the difference between prohibiting the sale versus prohibiting use or penalizing use, purchase, or possession, sometimes what are called PUP laws, purchase, use, and possession laws that really are oftentimes not effective for different population groups in terms of deterring use, and B, really fuels interactions between youth, other communities, and law enforcement that have detrimental lifelong impacts that, as we know, really are the social drivers of health as well. Really taking away economic, educational, and other opportunities. So it's really important to have that policy at an upstream sales level. And then we can go to the next slide. Also have to put in a recognition and plug for cessation programming. Oftentimes we see these policies put forward, and the recognition of cessation and support services for people who are addicted is not always equivalent in terms of being front of mind and center of the focus here. So it's really important. It's not just about preventing future tobacco initiation, but it's also about supporting those that are targeted and addicted by these products now. For example, when we saw Tobacco 21 policies put into place, super impactful. It is really important to recognize that there are going to be many 18 to 20-year-olds who are no longer going to be able to be sold those products, but maintain a very strong addiction to these products. So having state and local cessation resources increases the likelihood of success of the policy, of the individuals and populations that are addicted, and just justly provides support at it's kind of a justice and fairness level to those who've been intentionally targeted by the tobacco industry and suffered those negative health consequences. And we can move to the last slide, which is just, a recognition that before beginning in the policy planning stage, and this is shown out through the case studies of policies that have been put into place regulating the sale of products, particularly, but many tobacco control policies. It's just really important to recognize that relationships with stakeholders must be solidified. So community members who have been well respected, and could support local informational campaigns, those who have relationships with local small businesses, leaders, organization leaders who represent larger underserved groups of people that have been targeted by the industry, and those who are familiar with the tobacco corporation tactics and the history intimately, as well as policy experts. So having that coalition of support and really having authentic community level engagement at that ground level before putting forth a policy is really integral to make sure you're bringing people on board and that it's a policy grounded in what the community is saying and not kind of laid upon a community. And at that, I just want to thank you all. It's been a real pleasure to present to you on this super important topic, and especially in May, it's just so relevant to what's happening at the federal level and other resources and campaign information that I'm actually going to pass over to Ashley and the Tobacco Free for Healthy New Jersey staff to talk about some of the new campaigns and materials that are now available through them and through our national partners. So I'll turn it over to you, Ashley.
Thank you so much, Jacob, for all of that really timely information. We really appreciate everything that you shared about the marketing piece and menthol and flavored tobacco and the policy piece as well. And that's great. Shout out to North Bergen. Thank you, Elise, for sharing that. Hopefully our other communities and municipalities can also start adapting that as well. I do want to turn it over now to Kim and Elise. As some of you may know, our Tobacco Free for a Healthy New Jersey team is divided into 3 separate regions, our North, Central, South. So I will turn it over to Kim and Elise to introduce themselves and kick off our No Menthol May campaign.
Hi, everyone. I'm Elise Knapp. We met earlier, and I'm the Tobacco Free for Healthy New Jersey Northern Region Coordinator. I'll pass it over to Kim.
Good morning, everyone. Kim Burns from the Southern Region for Tobacco Free for Healthy New Jersey.
Okay, so here's our we're really excited about this next section. I did want to just take a moment and thank all of our attendees today, because I see so many of our community partners have joined this webinar, and we truly thank you for your ongoing support of our work. And I also wanted to thank our 3 speakers for their excellent presentations. We had 3 different perspectives: addiction and treatment lens, our community impacts, and policy lenses as well. And now it's like our call to action section. We've got some great facts behind us. And we're proud to announce that we are kicking off our No Menthol May initiative. And that builds on the No Menthol Sunday initiative that Pastor Castine spoke about earlier. And we've been participating in that No Menthol Sunday initiative for several years, but now we're going to take this initiative and awareness to an entire month. And you can see here that we have a QR code if you wanted to, take your camera and grab some of that info. But don't worry, we've got plenty of resources to share. And I think we could just go to the next slide, which is an overview of why our team is highlighting this initiative for the month of May. It's a statewide campaign that we're launching for the first time, which is focused on addressing the health disparities caused by the use of menthol tobacco products, which disproportionately affect communities of color. Through educational campaigns, community outreach efforts, the group aims to protect public health, particularly in vulnerable populations, and reduce tobacco-related harm in New Jersey. These efforts are part of a broader movement to advance tobacco control and ensure a healthier future for all of us and all of us here in New Jersey. And now I'm going to pass it over to Kim, who's going to share all the resources that we have available.
Yeah, so as it's been mentioned, No Menthol Sunday, we want to encourage you to go on to their website. There's a wonderful toolkit on there that can be used both in our faith-based churches and facilities, and also in the community. So we encourage you to go on and download this toolkit. We really have created our resources to come hand in hand with that toolkit. So you'll see we even kept the colors scheme going in what we've produced. So again, we encourage you to go to nomentholsunday.org and download that toolkit there. Okay, so just looking at some of the things that we have been able to create, and Elise, I missed it. I don't know if you mentioned, but we have had a No Menthol May work group going on for, I think, almost 2 months. So we invited members, collaborative agencies to join us, our partners to join us on that. We wanted really to get input from across the state as to what would be most useful in our communities, and what people really would like to see us produce. So we're going to show you some of the flyers, and we have printed these. So we're going to tell you at the end how you can get your hands on these, or as we mentioned, you can go on to our No Menthol May website, or a page that's on our website, and download them. We can make them so that you can put your own logo on there with ours. So I want to encourage you to reach out and to use all of these resources. So the first flyer here, just continuing the theme of the webinar, Flavor Fades, Addiction Stays. again, just about getting the truth out about menthol. And then what can we do to protect our health and our community health? And you can see all of our resources here are both in English and Spanish. They're actually a front to back. So, you can utilize these wherever you need, and both languages will be there. So our second flyer, we thought it was really important to address the myths, just as we did in this webinar. What are the myths around menthol? And then we put the facts right next to that. So, often we get questioned about them, and we picked the top 4 and then just added, what's the truth? What are the facts? Oh, there's nothing showing? Corinne says nothing showing.
No, I don't see anything showing if you are demonstrating via the website.
No, the flyers are on there. Can you see those, Corinne?
I can pull up the website, but I don't see, I mean, I don't know if I'm the only one that doesn't see it. Maybe I'm the only one that doesn't see it.
Okay. I can
There
see
are
them too.
flyers showing.
Okay.
Flyers are showing.
I think there's 2 people logged in under my name, so maybe I can't see.
Okay.
Thank you.
Okay.
Sorry about that.
No problem. No problem. Just wanted to make sure everyone can
There are
see
2
them.
websites in the chat. There are 2 websites. One is for No Menthol Sunday and one is for No Menthol May. One is Tobacco Free's website and one is the Center for Black Health and Equity's website.
Great. Thank you, Ashley. Okay, so the second flyer, and again, we have these produced, or you can download these from our web page. Okay, so then we created a couple of rec cards. So again, these are printed. The first one to the left, let your voice be heard. So what can we do in our communities to really make this an issue, to start the conversation, to make sure that we're dispelling the myths that are out there, to make sure that people are educated. Just as Mike shared with us, that it can often be more difficult for someone that's smoking menthol to quit. These are things that individuals need to know. So, so important to have these facts. Again, both of these rack cards are a front to back, English and Spanish. The one on the right, just some really important menthol facts. What do we need to know? And again, this is to arm you with education so that you can pass this along to our community members, pass this along to those that are in charge, pass it along to your faith-based churches in your community. Okay, we also have some fun bookmarks that we created, fun bookmarks with a purpose. Okay, if you can see, the one side has quit resources on it. So all someone needs to do is scan that. It'll take them directly to our quit center. You can see we have information on Mom's Quit Connection and also the quit line with the same theme: flavor fades, but addiction stays. So we have these printed and available. I'll also add that we have made some gorgeous fans. They're a clear with the No Menthol May on them. We have some green menthol colored wristbands. And we have some mints. And the theme of the mints is pass a mint, not a menthol. So we tried to get fun with what we were creating. Did I leave anything? Oh, and we also have coffee sleeves. So, if you're in a church and you're serving coffee, or if you're out in the community, I know one of our community partners said yesterday they're out with the Hope One van, and they're going to be providing those on some drinks that they're giving out in the community. So, we encourage you to take these materials and really get creative with them and use them in your community. Okay, so again, wouldn't be a webinar unless we highlight our wonderful cessation services that we have across our state. When you travel to other states, you realize how fortunate we are here in New Jersey. Many, many things for everyone from our youth. We have a youth quit group that they can join. We have our Text to Quit program. And then we have some specialty groups that really reach out and work with individuals that are looking for either a Spanish speaking group or a LGBTQ plus group. We also have some resources for families through our Mom's Quit Connection and our Quit for Kids program, in addition to our quit line. and quit centers. I think we mentioned that on a previous one, but 11 quit centers across the state that are there and ready to help our New Jersey residents. So I do want to encourage you. I am not remembering the dates. I think the North has a regional tobacco collaborative coming up really soon.
This Friday.
This Friday.
May 2nd,
So-
10 o'clock in Randolph. We'll be in Randolph at the municipal building. Not too late to register.
Yeah, so scan that QR code and get your self there. And then Central also has one coming up later in the month, May 14th.
May 14th, yeah.
Unfortunately, if you live in the South, ours was yesterday. So we were able to provide some of those resources. But if you still were not able to make that meeting, or, you know, any of the flyers or information that I mentioned, the giveaways, please just scan the QR code. It goes directly to my email, and we can make sure that we get those resources to you. Really want to encourage you to get plugged in and really a statewide effort on this. We're excited. To my knowledge, I don't know of any other states that have done a whole month devoted to promoting you know, education about menthol. So we really encourage you to join on and be part of this. And lastly, I want to encourage you to join us at the NJPN annual conference. Tobacco Free for a Healthy New Jersey will have a presence there. So if you are there, please stop and see us, grab some of the resources there, but scan this QR code, help us come out and celebrate NJPN celebrating 25 years of working on prevention and treatment in the state of New Jersey.
Of course, here's how to reach us.
Yep, these are our contacts.
And, you know, I also wanted to add, Kim, that our team is developing No Menthol Sunday social media content.
Yes,
So we will have posts throughout the month of May. If you, you know, are involved with social media, you know, it's a great way we could reach out. Here's our contact, and we could collaborate, you know, the whole like and share, and we can do all of that as well. So you could spread that message via social media.
Great. And I think Ashley's going to do some questions and answers now.
Yeah.
But I want to encourage you, we're going to come back after the questions and answers, and we're going to ask, how are you going to promote this in your community? So be thinking of this, because we want some great answers.
Thank you so much, Kim and Elise, for sharing the kickoff to No Menthol May. Thursday starts May 1. Please follow us on social media. We'll drop in the chat our social media handles, because we are doing some No Menthol May challenges. We're trying to grab a mint, not a menthol, pass it around to our community partners and record ourselves. So thank you all to our wonderful speakers for sharing all of your knowledge and information with our New Jersey partners today. And thank you all of you for taking the time to join on this webinar. We do have some questions that we would like to address. If anybody has additional questions as we're going through, please feel free to drop them in the chat or the Q&A feature. Our first question, this is sort of a few parts question. This is specific for Pastor Ritney. So which I think also Jacob did address a little bit about prohibiting the sale and not the use of menthol products. But our question that came in for you, Pastor Ritney, is can you address the backlash and negative messaging to Blacks and Hispanics brought on by tobacco companies regarding the elimination of menthol flavors? They learned that negative messaging included that eliminating menthol flavor is discrimination, as African Americans who smoke would be greatly affected, and the fear that law enforcement would arrest them if they were found smoking menthol, and then would be arrested as well.
Actually, I'm not seeing Pastor Ritney on, so he may have dropped off.
Okay.
Okay. But that is a great question.
That is a great question.
Yeah.
Jacob, would you like to sort of take this? I know you addressed this a little bit in your slides about, you know, we want to prohibit sale and not use. Would you like to speak to this a bit?
Yeah, I mean, I think what we saw, unfortunately, in is really important, valid concerns, and in many cases, examples in other spaces, in other areas of a history of, racial profiling in law enforcement, unnecessary or over policing in many communities across a myriad of things. And that history is historical and so present today. So in every respect, it's such an important recognition and truth. I think what is saddening is that the tobacco industry manipulates that understandable concern, that fear, that truth, to kind of weaponize this approach, because they know it's going to be much more supported and impactful than telling the truth about their own interests of why they want to oppose a menthol restriction, and so that they then hopefully have connections in communities that they can use as sort of their conduit to that message, and help amplify the message that these policies are going to have that effect, or are based in a sort of discriminatory frame. And I think it's really important to one, recognize that the policy, the way it's established, is very important to being sure that it's equity centered and based on a sale approach and is upstream in all of those ways. So, leaders, public health, government should not be let off the hook for how implementation and how crafting of this is done. I think what it does also though show is that the precedent and the history of how these policies have been constructed, when they're well constructed, is that they have that upstream intervention that supports communities, that supports those who've been addicted, and it hopefully helps elucidate for community members that there is never a healthy relationship between tobacco communities, between the tobacco industry and communities. And so when you see those relationships there and you see those connections there, it's important to be really skeptical. And I think it's important to recognize the history there, that in every step, when you look presently and you look historically, those relationships, either at the moment or in hindsight, have always been manipulative for the gain of the tobacco industry. So I know that maybe that was a long-winded response, but I just think I wanted to give credence to that really clear rationale and understandable concern and reality, but ensure that there's a recognition that the industry is weaponizing that to oppose policies that impact their bottom line, and are doing so in a way that is having really detrimental impacts on those who are addicted and who experience the disproportionate burden of tobacco-related disease and death in the communities. And those are our Black and Brown communities. Those are other underserved communities. And so, that's why we are all here, hopefully to kind of help raise that message, and show the facts and show the data, and work at the community ground level to ensure that those concerns, that reality is understood, and that way when policies are crafted, they're done in the right way. And I think that is very much possible, and the data shows that is very much possible, and done with the right leaders who have the right training, and have the right approach to it.
Thank you, Jacob. Could I just wanted to expand on, you talked about PUP laws earlier, right? Purchase, use, and possession. And we do not have those laws in New Jersey. Just if you're not aware of that, right? Like, I'm just saying, not to you, Jacob, because I know you're very well aware, but if you're not aware, those of you on the webinar, right? So, and you heard when I talked about the policy in North Bergen, and we have many other model policies that we'd be so happy to share. The burden is on the stores, right? The merchant, to make sure they're not selling underage, right? Age of sale is 21, and the flavored products. We know there are issues with enforcement, but when you get a good, strong local policy, now you have, that list held right with the town, that enforcement. It isn't just about the fines, right? And that part of it. It is also about keeping the merchants up to date. One of the things I shared last Thursday in North Bergen was, we have all these wonderful point of sale materials, how to read the license, the nice New Jersey license plate sticker that says Tobacco 21, and, working that way, right, with communities, with the stores too, so that, that isn't, should not be how the policies, are working out, in terms of worrying about individual burdens, right? But again, I feel like that's why also that No Menthol Sunday or No Menthol May, those strong community voices, which all of you are, help to get that word out. And, those materials that Kim talked about where we've got the truths and the myths, I think that's what, Jacob was talking about there, and that question was about. So you've got materials now that, you can share with the community to dispel some of those myths. I don't know if we have any other questions. Are we going to move on to see if we have any folks who want to just share how they're going to bring this to their community, what they might plan? I know we had earlier Rhonda Thomas Booth said she's going to add this to her May newsletter. So she's thanking us and we're thanking you.
Does anyone have any upcoming events, not specific for No Menthol Sunday or No Menthol May, but something that you're doing in the next month or so that you can maybe tie this in and bring resources and materials, tabling events, or meeting with community leaders, legislators, anything like that?
We had a question in the chat about, will there be physical copies? Nessie de Chavez asked that question. And yes, I know you answered yes, but again, if you weren't looking at the chat, right? If you're going to come to an RTC meeting, yes, but we'll work with you. We can get those things in the mail. We can always find a meetup place, which I know people in the North know. We'll find a meetup place somewhere in between us, right? We'll find a way to get those materials. So there are physical copies and wristbands and all the things that we shared.
Right. So we just want to encourage you, hopefully you're mulling it over and coming up with some fantastic ideas. We're hoping to see those on social media. We'll be posting some of the ones that we're doing also. But, mull it over, reach out to your regional coordinator just to see how they can support you. If you need any additional resources, we do have them and would love to provide them to you.
Yeah, so we'd encourage everybody to, you have all our contact info. If again, next week, the start of May, throughout May, you think about, oh, I could use these at this event, or however you're going to share this out. Let us know, because we love to track that and just have a good sense of the impact and the outreach of this No Menthol May initiative.
Thank you. And I think it's important to note too, we do keep saying No Menthol May, but this goes year round, right?
Yeah,
So we don't want to just focus in these 31 days and then it's over. We want to make sure we do it for the entirety of the year. I saw someone say they had an event in June, and it just reminded me that, yes, we don't want this to end just for May. May is our kickoff. This is where we get the information and the resources out there. And then beyond that, we'd like to continue this conversation. But again, thank you so much, Mike. Thank you, Jacob. Thank you, Pastor Ritney, Kim, and Elise, for sharing all of your knowledge and insight with our New Jersey partners today. We are strong here in New Jersey, and we have a lot of great resources and free information to share with everybody. We will have a recap email with all of the resources and contact people for anything that you need. Our upcoming events where we'll be sharing the free resources and materials, and then the recording will be available on the Tobacco Free Tuesday section of our website. So thank you all again so much for joining us. Enjoy the rest of your Tuesday, and we will talk to you all soon. Can't wait to hear all the great work that everybody is doing.
Grab a mint, not a menthol.
Yes.
I love it.
Yes. We'll see you on social media for our campaign push.